Hello everyone, how are you all? Hope you're all healthy, happy, and safe. So, today's vlog is a medical vlog. I want to do a video on dengue fever because I've been visiting to hospitals since 2 days, and moreover, I'm an MBBS graduate. So, today I want to do a medical video. Since these 2 days, I've been observing that dengue fever cases have been admitted in the hospital. So, I just want to share my knowledge about this dengue fever with you all. Hope this video will be useful to you all. And please, like if you're new to my channel, please subscribe my channel. So today the topic is dengue fever. So dengue fever is a mosquito-borne disease. So it is usually spread by a female mosquito of species Aedes aegypti. Usually, what are the symptoms of this dengue fever? We usually see high fever, vomitings, muscle and joint pains. Typically, we'll see a rash. Okay, so these are the symptoms of dengue fever. And there will be low white blood cell count. There will be also low platelet count. And there will be also plasma leakage, which leads to hemoconcentration. That means increase in hematocrit. Okay, this dengue fever can also lead to dengue hemorrhagic fever or dengue shock syndrome. This dengue shock syndrome is usually associated with low blood pressure. So it's a severe case. So dengue shock syndrome is a severe case. So dengue, when it becomes more severe, it leads to dengue shock syndrome. Okay. So how can we detect this dengue fever? What is the diagnostic method? So it is detected by detecting the antibodies for this virus or its RNA. So what is the virus which is causing dengue? It's dengue virus. So it is mainly spread by Aedes aegypti female mosquito. Okay. So what are the differential diagnosis of dengue fever? So we have fevers like chikungunya fever, which has similar symptoms with dengue fever. So other differential diagnoses of dengue fever are malaria, typhoid fever, yellow fever, even Zika fever also has similar symptoms with dengue fever. Okay. So viral hemorrhagic fever, all these are the differential diagnoses of dengue fever. Influenza. So these all have differential diagnosis. These are all the differential diagnoses of dengue fever. Okay. So there are 3 phases in this dengue fever. First one is febrile phase. The second one is critical phase, and the third one is recovery phase. So in the febrile phase, we usually see sudden onset of fever, that is usually high fever, and we see vomitings, bleeding from the nose and mouth. We see diarrhea. We see a typical rash. The second phase is the critical phase. In this, we usually see hypotension, pleural effusion, ascites, and gastrointestinal bleeding. And the third phase is the recovery phase. In this, we see altered level of consciousness, slow heart rate, seizures, and itching. So these are the 3 phases of dengue fever. So this fever, I already told you, it can be detected by detecting the antibodies or of this virus or its RNA. So what is the treatment for this dengue fever? It usually fluid balance is the main therapy for this dengue fever. So for mild cases, for suppose like acute dengue fever, we usually treat by giving fluid therapy like oral rehydration therapy. If there are no warning signs, if the patient is like he's fine, if he can drink water and if he can pass his urine properly, he can be managed at home itself with a proper fluid balance therapy like oral rehydration therapy through mouth. If it is mild or moderate case, it is usually intravenously we will send the fluids. If it is severe case, we will usually go for blood transfusion. Okay, so in severe cases, we usually go for blood transfusion because they will be severe bleeding. Paracetamol is used for reducing the fever and it is also used for pain relief. But NSAIDs are not used like aspirin or ibuprofen because they cause usually high bleeding. So NSAIDs are usually prevented. Okay, so this dengue fever is also associated with some neurological disorders like transverse myelitis and Guillain-Barré syndrome. In pregnant women, this dengue fever, if it occurs, it usually leads to miscarriage or low birth weight birth or premature birth. Okay, so I said you already, like this dengue fever is treated with fluid balance therapy, like oral rehydration therapy through mouth. Okay, and in moderate cases, mild to moderate cases, intravenously we will send the fluids. So if the patient is recovering from the dengue fever, usually we will stop this intravenous fluid infusion because there will be fluid overload. Okay, so if the patient is out of the critical phase, this fluid overload is prevented by giving loop diuretics like furosemide to take away the excess fluid from the circulation. So this is the brief knowledge about dengue fever which I have and I wanted to share with you. So please be careful. And how to prevent this dengue fever is like there will be dengue fever vaccine, and less exposure to mosquitoes will prevent from dengue fever. So please be careful from this fever, and please use mosquito nets and mosquito repellents, because I have been seeing and noting dengue cases are more now in Bangalore. Dengue cases have been admitted more in Bangalore. So please be careful from mosquitoes. Thank you everyone. Hope you all like this video. If you like this video, please like, share and subscribe the video. And there will be a bell icon. If you press on that, you will get my next notifications. Thank you everyone.